Buenos dias. Hello. My name is Nathan Efron, and it is a great pleasure to be here speaking to you at this meeting. I would certainly like to begin by thanking the organisers for inviting me to come along to this meeting, which has grown in prestige over the years, and we are now enjoying the fourth Contactología Forum. The lecture that I am presenting is about silicone hydrogel contact lenses and the revolution that has taken place in the contact lens industry because of this particular product. Now, the first question we could ask is, why was it necessary to introduce into the market a new category of lens? Back in the 1970s and 1980s and 1990s, we had hydrogel lenses, and they were performing reasonably well. Why did we need to invent a new type of lens? Well, the answer is certainly very familiar to me. I published this book, Contact Lens Complications. The first edition was in 1999. It is now available in a Spanish edition. And this book lists all the possible complications of contact lens wear, which are shown in diagrammatic form on this slide. And accumulated research indicated that many of these complications were caused by hypoxia, lack of oxygen. And if we could introduce a contact lens that did not cause any hypoxia, we would then get rid of all of those complications caused by lack of oxygen. Now, many years ago, we had a possible lens that could do this. It was a silicone elastomer lens. They, in fact, became available in the 1960s. But these lenses were hydrophobic, they repelled water, and when you put them on the eye, they sucked onto the eye. They were very difficult to remove, and so they were a commercial failure. But we have long known that a silicone elastomer lens would be tremendous because it has such high oxygen permeability. So researchers for many years were trying to solve a problem. How could you develop a silicone lens but make it comfortable on the eye? And the answer was to combine it with a hydrogel. But this was almost impossible. It was like trying to get a perfect mix of oil and water. But the contact lens industry battled on and finally solved the problem by introducing silicone hydrogel lenses. There are now 10 different silicone hydrogel lens materials in the market at the present time. About one per year has been introduced since 2003, and this year alone, 3 new products have entered the market. Now, it has become fashionable to talk about silicone hydrogel lenses in terms of first generation and second generation. I do not really like that terminology, and I'll explain why in a moment. But the first generation lenses were silicone hydrogel bulk materials, but they were still slightly hydrophobic. And so a surface coating had to be put on the lens to make it wettable in the eye. And the companies that adopted that approach were Ciba Vision, with night and day and air optics, and Pure Vision by Bausch & Lomb, and also more recently Premio by Menicon. And that is the so-called first generation technology. The second generation technology is different in that wetting agents are incorporated within the polymer. So there is no need for the extra manufacturing step of introducing a surface coating. And the companies that have taken this approach are Johnson & Johnson, Cooper Vision and Southland. Now, there are certain manufacturing advantages for the second generation products, but the point that I wish to make is that second generation does not mean superior generation or superior products. All of these products have a lot to offer our patients. And when I get to the end of this lecture, I will explain how we can go about choosing between the different silicone hydrogel lens products on the market. Now, here we have the original map of the world that we teach to school children in Australia. And you can see Australia is in the proper position centrally and superior in the world order. I come from Brisbane, which is indicated by the star. But the reason I am showing this slide is to illustrate the fact that for the past 15 years almost, I have been conducting, together with Dr. Philip Morgan and other colleagues around the world, an international survey of contact lens prescribing. And I am going to use this data to try and understand what is happening here in Spain in the context of the rest of the world, to govern our thinking throughout the remainder of this lecture. I have had many colleagues assisting from many countries around the world, and you can see there that in Spain, Jacinto Santo Domingo has kindly conducted the survey with us. Now, what I am showing here is data for all of the different countries in the world that we survey along the x-axis. So here are all the different countries in the world. And the vertical scale is the proportion of soft lens fits. And I want you to concentrate on the yellow bars, which is silicone hydrogel daily wear, and the red bars, which is silicone hydrogel extended wear. So just look at the top of the yellow bars, because this indicates the percentage of soft lenses prescribed in the different countries that are silicone hydrogel. Now, where is Spain in this ranking? Let me show you. Way down here. What is happening in Spain? Why are practitioners in Spain reluctant to be fitting silicone hydrogel materials? I am not sure of the answer, and perhaps later we will find the answer. But let me move on. An important question that we asked when these lenses came onto the market was, are these lenses actually better? Well, there are various ways of answering that question. All of the initial studies that were conducted were on extended wear. That is because when silicone hydrogel lenses first came onto the market in 1999, they were advocated for extended wear. So all of our initial studies were with extended wear. And there were a number of very important papers published, like this one from Professor Brian Holden's group in Sydney, Australia, which explained that the hypoxic effects of silicon hydrogel lenses were negligible. In other words, with silicon hydrogel lenses for extended wear, we no longer were having hypoxic problems. Here is another example of a published study from Dr. Noel Brennan, also in Australia, looking at patients who wore a silicon hydrogel lens in one eye and a conventional hydrogel lens in the other eye for extended wear. And they found that in the eye wearing the silicon hydrogel lens, there was a much lower response of epithelial microcysts. There was a much lower response, a superior response in terms of stromal edema or stromal swelling. The eyes were less red, so patients wearing silicon hydrogel lenses had clear white eyes in terms of the limbus and also in terms of the conjunctiva. So there were many other studies, and we don't have the time to consider them all, but all of these studies showed that silicon hydrogel lenses have solved the question of hypoxia, which is a tremendous advance. Now, an important issue when thinking about complications with contact lenses is the risk of developing microbial keratitis or an inflammatory response. And together with Dr. Philip Morgan, who is speaking this afternoon at this meeting, I published a paper that looked at the incidence of keratitis with silicon hydrogel and conventional lenses. Now, this slide here shows the incidence of keratitis of all levels of severity. And the data on the right here is for extended wear, and the data on the left is for daily wear. The vertical scale is the incidence of inflammatory events. And the first thing you see is that there is a much higher incidence of inflammatory events when you sleep in lenses versus daytime wear of lenses. Now, that was not a new finding. We've known that for 20 years. What was interesting is that we found no difference in terms of all inflammatory events of all levels of severity between hydrogels and silicon hydrogels. And when the contact lens industry first saw this data, they were disappointed because silicon hydrogels were meant to give a lower inflammatory response. But when we tried to publish this work, the reviewers of the journals kept saying, we are not interested in all inflammatory events, we are only interested in severe microbial keratitis, which is potentially sight-threatening. And so we were told, don't publish the data like this, but remove all of the data relating to the mild inflammatory events, that's the green colours, and only talk about the severe cases, which is the red and brown colours. So when we get rid of the green colour, we are left with this. And here we have a large difference between hydrogels and silicon hydrogels. Our study found that if you sleep in contact lenses, the risk of developing microbial keratitis is 5 times lower if you sleep in silicon hydrogels compared to sleeping in conventional hydrogel lenses. Now, this result has become quite controversial because some other colleagues that I have in Australia have published a more recent study which has come up with a very different result. When they looked at severe microbial keratitis, they found no difference between hydrogels and silicon hydrogels. So what should we believe as clinicians? What should you believe when you see this conflicting data? Well, all I can say is that you need to read these papers and make your own conclusions. Certainly the weight of scientific evidence is coming down in favour of the result that I obtained. For example, here is a paper that has been published this month in the journal Eye and Contact Lens from Linda Hazlitt's group in the United States. It was a study carried out on an animal model, and they had, in rats, they had one eye, or they had some rats wearing silicon hydrogel lenses and some wearing conventional hydrogel lenses. And they introduced Pseudomonas bacteria into the eyes, and they found a higher incidence of infection in the eyes wearing the conventional hydrogel lenses. So this study shows that silicon hydrogel lenses reduce the risk of getting microbial keratitis, and that is in an animal model. So further research needs to be done to better understand this issue. If we look at this graph again, it's the same graph I showed yesterday, earlier, but reorganised. So just look at the red colours here, which is extended wear silicon hydrogel in the different countries in the world. The percentage of lenses prescribed for silicon hydrogels is always less than about 15% or so. And in Spain, it is very low at around about 5 or 6%. Let me now talk about a related issue, which is the oxygen performance of silicon hydrogel lenses. It's important to understand the oxygen permeability of these materials. So, again, Philip Morgan and myself conducted a study to look at the data, and this is our data shown in green compared with the manufacturer's data shown in red. So there are now 10 different silicon hydrogel lens products on the market. This is the DK value on the vertical scale. Here are all the silicon hydrogel lenses. And this is the AccuView 2 lens, a conventional hydrogel lens. And you can see when you compare my data in green versus the manufacturer's data in red, you can see that there is general agreement. So this is good news. This means that we can believe the values of DK that the industry is supplying to us. Generally speaking, there are a few slight discrepancies, but there is generally good agreement. And when we look at DK on T values, oxygen transmissibility as well, there is good agreement. Now, it is interesting to consider the relationship between oxygen permeability and lens water content. And this line here describes that relationship for conventional hydrogel lenses. So the higher the water content, the higher is the DK value. All the data falls nicely on a line. Well, what about silicon hydrogel lenses? Well, the graph goes in a different direction. This is what we would predict would be the answer, because the less water and the more silicone you put in the lens, the higher will be the oxygen permeability. And when we look at the actual data of the 10 lenses on the market, we see the relationship is not so tight as for hydrogels, but still roughly falls on the expected relationship. But whoa, what's going on here? The point that I wish to make is that we should be thinking not about DK values, but about flux, oxygen flux. Oxygen flux is the rate at which oxygen moves into the cornea. So we have a flow of oxygen into the eye, and that is the physiological measure we should concentrate on. We can measure this by placing an electrode against the eye and measuring the flow of oxygen into the cornea. This is me making measurements 30 years ago. You can see I have still retained my good looks. Huh? All right. Now, to determine the oxygen flux values, we need to do very sophisticated mathematical calculations. It's very complex. I will not go into the details, but I will show you the result we obtain. This is the relationship between oxygen flux and oxygen permeability of the lens before the year 2000. And this was a nice, simple relationship which said the higher the oxygen transmissibility, the greater the flux of oxygen into the eye. So life was very simple and very easy for contact lens practitioners in the 1990s and 1980s. But now we have oxygen transmissibility values that go way out here to 200. So I'm now going to compress that scale, and you watch what happens to the shape of this graph. It's now very different. For silicon hydrogel lenses, the relationship between dk over T and flux is a flat line. In other words, there is no difference between silicon hydrogel lenses in terms of the amounts of flux, the oxygen flux going into the eye. Which means when you are choosing between different silicon hydrogel lenses, there is no need to consider the oxygen transmissibility because the oxygen flux is the same for all lenses. Now that is the outcome of Brennan's analysis, which many different researchers agree with. However, some of my colleagues at CBER have analysed the flux data using a different mathematical model, and they come up with a slightly different result, which basically agrees with Dr. Brennan, except for the situation where we have perhaps very high minus powered lenses. So for silicon hydrogel lenses, maybe -8, -10 and above, where the edge thickness is very great, then the flux will be perhaps a little bit too low, and in those circumstances we need to choose a silicon hydrogel lens with a higher dk on T value. But for the vast majority of our patients, there is really no difference between silicon hydrogel lenses in terms of the flux of oxygen into the eye. Now let's look at the results of more recent studies that have been done with open eye lens wear, daily wear. This is a study that, again, I conducted with colleagues in Manchester a few years ago, where we took 62 subjects who had never worn contact lenses previously. 19 of these subjects were just pure controls for the experiment. 14 subjects wore conventional hydrogel lenses. 14 subjects wore low decay silicon hydrogels, and 15 subjects wore high decay silicon hydrogels. Now, if Dr. Brennan's flux theory is correct, there should be no difference in the ocular response between a low decay and a high decay silicon hydrogel lens. So here is an example of some of the data that we obtained. This is a conventional hydrogel lens, and you can see a nice white eye. And after 2 weeks, you can see more redness here on the conjunctiva. With the low decay silicon hydrogel, we have a nice white eye, and 2 weeks later, we still have a nice clear white eye. And that demonstrates the benefits of silicon hydrogels. But what about low versus high decay silicon hydrogels? Well, there was a lot of data, but let me show you the data for limbal redness. This is the data at baseline. So the vertical scale is the amount of limbal redness. So you can see for the conventional hydrogel, the AccuView 2 lens, after 2 weeks there was an increase in conjunctival redness, and also after 4 weeks. But look at the rest of the data. The eyes remained white whether the patients wore no lens, or a low decay silicon hydrogel, or a high decay silicon hydrogel. There was no difference in eye redness between the low and high decay silicon hydrogel lens. So this data here supports the flux theory of Dr. Brennan. And when we just look at the data in different countries for daily wear, the red colour here is daily wear silicon hydrogel. Again, Spain is way down the bottom of the order, and I am not sure why this is. Here is some interesting data from Dr. Graham Young in England, who looked at the performance of silicon hydrogel lenses in challenging environments. So basically what they did is they took a number of patients who were wearing their habitual lenses, their regular conventional hydrogel lenses, and they asked the patients what percentage of patients had good comfort with these different silicon hydrogel lenses. They were then refitted with silicon hydrogel lenses. So that's the data with conventional hydrogel lenses. They were refitted with silicon hydrogel lenses, and there was always an improvement in the comfort response. And this is in air conditioning, low humidity environment, a smoky environment, and so on. In challenging environments, silicon hydrogel lenses perform very well. Now, the problem with this data is that the experiment was not very well controlled. There should have been a control group who were given a placebo lens, and that wasn't done. But nevertheless, this data suggests that silicon hydrogels will perform well in a challenging environment. So, to bring me towards the conclusion of my lecture, how do we use all of this information that I have discussed to choose the best silicon hydrogel lens? What are the important criteria we should apply when choosing a silicon hydrogel lens for a patient who is sitting in front of us in a consulting room chair? Should we be considering the oxygen transmissibility of the lens, the design, the optics, the water content, the modulus, the surface wettability, the surface lubricity? Which of these are important? Well, if you've been listening to me for the past 35 minutes, you will know that there is one of these we can cross off. Yes? Oxygen transmissibility. All silicon hydrogel lenses are the same in terms of oxygen transmissibility. So we need to concentrate on the other measures. And let me briefly look at some of these some of this data. Water content. So the different lenses, the different silicon hydrogel lenses, have different water contents. And the more silicone in the lens, that means the less water in the lens, then theoretically that lens would tend to be more uncomfortable. But in fact that is not the case, because the contact lens companies that have lenses with lower water contents have a surface treatment on the outside of the lens to make it wettable in the eye. So although there is a difference in water content between silicon hydrogel lenses, they are all more or less of equal comfort in terms of the comfort that is related to the water content. So water content is not especially useful in choosing between silicon hydrogel lenses. What about modulus or stiffness? There has been much discussion about this in the literature, and there is certainly a big difference in the modulus or the stiffness between different silicon hydrogels. The first generation materials tend to be stiffer, and the second generation, generally speaking, tend to be a lower modulus or more soft. Is it true that a lower modulus, a more flexible lens, is always better for our patients? Well, in terms of comfort, that may be the case, but for many of our patients, the issue is wanting to have the lens sit nice and proud on the finger, so it's easier to get in the eye, it's easier to handle. So some patients will prefer a stiffer lens of a higher modulus. So if lens handling is the problem you are dealing with, you will go for a higher modulus. If comfort is the issue you are dealing with, you'll go for a lower modulus. If you want a nice balance, you will go for somewhere in between. The point is, all of these silicon hydrogel lenses have something to offer in terms of choosing an appropriate lens for our patient. What about surface wettability? Well, in this case, probably a superior surface wettability will give increased comfort and less surface deposition. The problem is, it's difficult to compare different products because measuring wettability is very methodologically dependent. It depends on the methodology. This is data from Lyndon Jones, which shows a hierarchy of these lenses using the advancing angle technique. But if you were to use the Wilhelmy plate technique or the captive bubble technique, and if you were to pre-treat the lenses in a different way, then you can get all sorts of different results. So my message is be very, very careful when presented with wettability data, because it can be shown to favour almost any lens product. It's a difficult area. A more recent measure is one called lubricity. Lubricity means how slippery, how sort of easy it is to slide the lens around between your fingers, how slippery the lens is, lubricity. And this is lubricity data from Professor Brian Tye, who again shows a big difference between certain lenses. So is it better to have a lens with superior lubricity? That's down here, low coefficient of friction, so superior lubricity, or inferior lubricity? Well, it depends again on what you're trying to achieve. A lens that is more lubricious may be more comfortable in the eye, but also it may be more difficult to handle. It slips out of your hand, it doesn't sit on your finger, it slips around. So if lens handling is the issue, you may want a low lubricity, and if comfort is the issue, you might want a high lubricity lens. Okay, so to come towards the very end of the lecture, what can we expect in the future? In the future, I think we will see more silicon hydrogel products with value-added technologies. So what I think we will see over the next 5 years are silicon hydrogel lenses with antimicrobial properties impregnated in the lens. We will have silicon hydrogel lenses with anti-inflammatory agents built in. So our patients with hay fever problems will be relieved of that with these anti-inflammatory lenses. There is research into putting very fine, very small channels and grooves and patterns into the back of the lens to create better tear exchange and a healthier surface beneath the lens. And I think we'll have enhanced surface technology such as more lubricity, superior wettability. There are going to be further developments in that area as well. Now, perhaps some of you have noticed throughout my lecture, popping up at you throughout my lecture, this lady here. Yes, you've seen her come up throughout my lecture? You all know who that is, don't you? Yeah? No? This lady is your patient. And she's happy with thumbs up. The reason she's happy is she's wearing silicon hydrogel lenses. And you know, the real measure of success in practice is to have happy patients who have fewer complications. If we have that situation, we'll have greater job satisfaction as practitioners and we'll have more profitable practices. And I think it is true that you will maximise your clinical success by using premium contact lens products like silicon hydrogel lenses. So we have seen Spain is a little bit behind in that regard, and I would advise that if you have not already done so, you should join the silicon hydrogel contact lens revolution. Thank you.